Vaccinations have been a topic of debate for several decades, with strong opinions on both sides of the spectrum. Proponents argue that vaccinations are a crucial tool in preventing the spread of infectious diseases and safeguarding public health. They believe that through vaccination programs, we can effectively eradicate diseases that have plagued humanity for centuries. On the other hand, skeptics express concerns about potential side effects and question the necessity of certain vaccines. They argue for the autonomy of individuals to make informed decisions about their health. In this book, we will explore the controversial issue of vaccinations, presenting arguments from both sides to help you form your own opinions. Proponents of vaccinations emphasize their significant role in preventing the spread of infectious diseases. They argue that vaccinations have played a pivotal role in eradicating or minimizing the impact of diseases like smallpox, polio, and measles. Vaccinations create herd immunity, making it more difficult for diseases to thrive and spread within a community. By vaccinating a large percentage of the population, we can protect vulnerable individuals who cannot receive vaccines due to weakened immune systems or in any device respect to it. Take a look. This collective protection ensures the overall well-being of society. Skeptics, however, raise concerns about potential side effects associated with vaccinations. They argue that vaccines can have adverse effects on certain individuals, ranging from mild reactions like fever or soreness to rare instances of severe allergy. They can trade addition for diseases exploration. All explorations created free export. There is some inflammation. They believe that individual medical histories and genetic factors should be taken into consideration when making vaccination decisions, rather than adopting a one-size-fits-all approach. Safety is a primary concern for vaccine supporters, who argue that extensive research and rigorous testing ensure that vaccines are safe for the general population. Before a vaccine is approved for public use, it undergoes multiple phases of clinical trials to evaluate its efficacy and safety profile. Regulatory agencies, such as the Food and Drug Administration (FDA), closely monitor the development, testing, and manufacturing processes of vaccines. Vaccine advocates argue that the benefits of vaccination far outweigh the minimal risks associated with potential side effects. Opponents of vaccinations often express concerns about the perceived influence of pharmaceutical companies on vaccination policies and programs. They question the motivations behind vaccine mandates and the potential conflicts of interest that may arise. Some skeptics argue that profit-driven pharmaceutical companies may prioritize their financial interests over public health. They advocate for transparency in the development, manufacturing, and distribution of vaccines to ensure that the public can trust the safety and efficacy. Welcome to this. One of the key arguments put forth by vaccine skeptics is the concern about the cumulative effect of multiple vaccines administered at a young age. They question the potential overload on the immune system and its long-term consequences. Some skeptics suggest spacing out vaccine doses or adopting alternative schedules to reduce the perceived burden on the immune system. Conversely, proponents argue that the immune system is more than capable of handling the antigens present in multiple vaccines, and that the benefits of immunization outweigh any potential risks. Vaccine hesitancy, fueled by misinformation and false claims, has become a notable challenge in recent years. Skeptics often rely on anecdotal evidence or misinformation spread through social media platforms, leading to misconceptions about vaccines. This misinformation can contribute to a decline in vaccination rates, leading to outbreaks of preventable diseases. Vaccine supporters stress the importance of reliable sources of information, evidence-based research, and effective communication strategies to counter misinformation and promote accurate knowledge about vaccines. In conclusion, the vaccination debate continues to be a contentious issue, drawing passionate arguments from both supporters and skeptics. Proponents emphasize the role of vaccines in protecting public health, eradicating diseases, and creating herd immunity. They assert that rigorous testing and safety measures ensure the effectiveness and safety of vaccines. On the other side, skeptics raise concerns about potential side effects, question the necessity of certain vaccines, and advocate for individual autonomy in making vaccination decisions. The challenge lies in finding common ground to address the concerns of skeptics, while upholding the benefits of vaccinations in safeguarding public health.